Corneal scraping provides the most valuable specimen in cases of infective keratitis for its diagnosis and management. Scraping is also done as therapeutic procedure for better drug penetration and sometimes to reduce the load of microorganism. In adults, corneal scraping is usually done under topical anesthesia and general anesthesia is required in kids and for mentally unstable patients. Though Kimura's spatula and calcium alginate swabs can be used to increase the yield of scraping, we generally use 15 number blade because it is disposable and it is easily available. I usually scrape on slit lamp, but if you have a facility of operating microscope and a recliner in your OPD, there is nothing great like that. Commercially available glass slides have dirt and smudge over it, so we clean glass slides with alcohol and keep it wrapped with aluminum foil. I usually cover the wrapper of 50 number blade to make it like a handle. You can also use a BP handle for that. After slit lamp focusing, I use the thumb of my left hand to hold the upper lid and use my right hand for the holding of 50 number blade. The illumination arm of slit lamp is moved towards left side as I am a right-handed person. My OPD staff makes sure that patient is comfortably seated, the chin and forehead is properly touched to the chin rest and headrest of the slit lamp, and staff also makes sure that the patient does not lean back. Classically, scraping is taken from the advancing margin and base of the ulcer, but many a times we have to modify it according to the type of ulcer. For example, in this patient there were 2 foci of infection and we had to take sample for at least 2 slides and at least 2 cultured media. So we scraped from both the sides and took sample twice from there. So these are the supplies required for basic microbiological workup: a lab microscope, gram stain kit, KOH stain, 15 number blade, glass slides, cover slips, a permanent marker, and few cedar oil or paraffin oil bottles. KOH is available as pellets. For preparation of 10% KOH, we have to add 1 gram KOH, which is about 8 to 9 pellets, with 10 ml of sterile water and a few drops of glycerin. We usually keep 10% KOH in an eye drop bottle for easy application. Gram stain is commercially available in bottles. For the ease of application, I keep these in 10 ml eye drop bottles labeled as 1, 2, 3 and 4 in the sequence of application, so that there is no confusion as the staining is done by my hospital staff. The scraped material is smeared over slide and the blade is covered by its wrapper and thrown securely. With the help of permanent marker, both the slides are encircled on the back side to mark the location of the sample and labeled as MR number, name, etc. on the front side. For gram stain, we have to smear the sample over the slide, whereas for KOH stain, we just have to put the sample over the slide, put a drop of KOH, 10% KOH, and then apply cover slip. Remove the excess KOH by pressure and then the slide is ready for viewing. Viewing is started on the lab microscope with 4x magnification and gradually increased to 10x and 40x magnification. Whereas for gram stain, after fixation, smear and staining, we have to focus on 4x magnification and then directly switch to 100x while immersion. If you want to photograph your bugs, you can use your mobile camera over one of the eyepieces. As I have to take pictures frequently, I have made a small adapter which provides fixation and fixed distance from the eyepiece so that I can take pictures quickly. This is how we plate the samples on blood agar, chocolate agar and SDA. These are sent to microbiologists. Labeling on culture plate is done on the culture media side, not on the cover side, because cover might get interchanged. Those comprehensive ophthalmologists who are treating corneal ulcer and are not having a lab microscope, for them, my humble appeal is that they must own a lab microscope. Please start with only KOH stain, which hardly takes few minutes. It will make a huge difference in the confidence with which you treat corneal ulcers. Thank you.